Okay, wonderful. I wasn't sure if there's an intro or anything. Well, hi everyone. I just found out that I'm kicking off this day, so that's exciting. I am Chelsea Dade, and I am the creator and executive director of Communicate for Health Justice. Um, and while we're in this presentation, if you could make sure you are muted, I'm hearing a little bit of background, and so make sure you are muted during the whole presentation. So I'll be talking today about health communication through new media, which I'm very excited about. Communicate for Health Justice is really a passion project of mine, and I created it using new media sources and a lot of attention to equity and social justice. So I'm excited to talk more about it today. So the learning objectives for my session, hopefully you'll get a more clear understanding as to why communicating about inequities through a racial justice lens matters for achieving equity. And I really do want to hone in on that, the racial justice piece, because now that in the space that we are in 2022, we need to be very specific when we're talking about which type of equity we are talking about, because there's lots of different forms of equity. Number two, hopefully we will all gain the understanding of the importance of utilizing new media in public health or healthcare communications, whatever space that you are in. And then hopefully that you can learn how to apply that for a more equitable public health response. Just a quick reminder, please stay muted during the presentation. Thank you very much. And the third learning objective, you'll hopefully receive a toolbox of new media resources that will better connect communicators with their intended audiences. So just want to start with a little bit more of a background on what is Communicate for Health Justice. And so really, it is a platform to challenge traditionally held ideas about health communication. So the way that I see it and the way I saw it in 2018 when I created the platform is that traditional health communications research and practice is really facing a challenge. You know, it lacks a really strong health equity focus, as well as a strong social justice perspective that takes history and also current social movements into account. And so the challenge then, this leaves professionals who practice health communication really behind, you know, practicing things that may have been the pattern in the 90s or the early 2000s, but we have moved past that. And so we need to really get on trend. And so sometimes that can even mean people falling out of the culture. I'm saying, you know, falling out of touch with the culture. And then also even creating digital or print health materials that don't necessarily resonate with the intended audience. And so that's really the challenge that Communicate for Health Justice is addressing. So the mission of Communicate for Health Justice is, as you see right here, to aid current and next generations of communicators to equitably create content centered around racial health justice. And then the vision, the larger scope here, is reimagining or rethinking the way of health communication that is socially conscious, it's racially conscious, and hopefully we can get to a point where that is more of the norm, where I know, you know, race and racism makes people very uncomfortable, but we need to really move past that. And so I hope to accomplish this hopefully within the next 10 years. I did put a time on there through creating and keep continuing to build this platform, you know, by providing workshops and training and consulting to individuals like yourself and other businesses. So Communicate for Health Justice, what is our secret sauce? What is our model? Well, as I mentioned, it was initially launched in 2018. So at the end of 2018, if you want even more backstory, I was in my grandma's house. She doesn't actually have Wi-Fi, and so I was using my hotspot to to connect with the internet. And I was like, you know what? I'm going to make a platform about health communication. So that's actually how it was started. It was around the holidays. And so I took a lot of the themes that I gained from my master's program at Northwestern in health communication, as well as my previous experiences practicing health communication, practicing health education in Washington, D.C., and then the Northern Virginia area where I'm from. And the blog, which that's how Communicate for Health Justice was started. And so I was reaching out to folks, you know, trying to see who else is interested in communicating for health justice. And so, and I've turned out a lot of people were interested in that, you know, people of all different ages. You know, I do have this in my title that Communicate for Health Justice is millennial driven, because I myself am a millennial. But, you know, my platform's open to everybody. And so that's really also, I think, what makes it a little bit different. Unfortunately, a lot of times in any health industry, really, there's a lot of silos that we create. And there's also a lot of like divisions and hierarchies. And I'd really try to challenge that. So in addition, and I think I mentioned this a little bit on the last slide, in 2022, so earlier this year, I actually wanted Communicate for Health Justice to take on more of a business model. So I have followers, I have partners from way back in 2018, and I kind of liked that I created it that way, where it wasn't initially a business model, because it allowed me to genuinely connect with people and genuinely really try to build bridges and relationships that weren't necessarily transactional at that point. And so now I'm able to facilitate those connections in a new and continue that authenticity. And so right now in 2022, Communicate for All Justice will host different social events, community workshops, as well as offer consulting. So Communicate for All Justice's target audience, you know, that involves health professionals like yourselves, communication professionals, you know, healthcare consultants, folks who work on insurance, people who work in public health departments, and the like. So it's pretty broad. You know, I'm open to working with anyone who wants to work on communicating for health justice. So how is Communicate for Health Justice different? And this is really the selling point. Clients come to Communicate for Health Justice because they want something new. So, you know, and that's really what my platform is built on. When I, you know, came out in 2018 with this platform, people looked at me like, what in the world are you doing? Like now in 2022, it's a very different, you know, place that we're in, I want to say. But, you know, when I was talking about racial justice and how it's connected to communications, like people were like, oh my gosh, like I don't see this, I don't get it. So I think we're still growing in that, but that's really one of the selling points of Communicate for All Justice. We're constantly looking for new ways to connect and to build bridges between, again, the history of health and then current social movements. And so it's also the health equity and social justice perspective. You know, I intentionally set it up that way, so it's not just about health equity. Sometimes we can get lost in just using the term health equity, and sometimes health equity does not necessarily correlate with social justice. And so it's very important to indicate that you are focusing on social justice or racial justice, or, you know, all the things that correlate with that. So that's why I do highlight both of those terms in our description. And then, as I mentioned, we do pay attention to the history of injustices in health, as well as current sociocultural dynamics. And so, you know, any major movement that you see, you know, a lot of times they do happen to be led by millennials. And so any of those movements, I will highlight them, and I will try to draw connections between those movements and health communication. So there's always connections. We just have to be willing and interested in looking for those connections. And then in addition, staying on trend is very important. You don't ever want to kind of fall by the wayside. Like I mentioned, it's so funny that I'm in this health communication space, because I remember distinctly being so interested in the ads about public health and, you know, food advertising and soda and drink advertising, because as a millennial, you know, we really grew up in that culture, and now we're seeing, you know, a lot more advocacy working against all of that, because, you know, targeting young people is just, in my personal opinion, wrong. And so, but I will say that, you know, as a millennial growing up, that I was very exposed to that. And so I think I've kind of taken some of that in the work that I do currently. And then I do like to always say that at Communicate for Health Justice, the goal is to learn and to unlearn and to challenge. And again, I'm unlearning things every day. You know, we're all unlearning. So it's not meant to be a judgmental space. It's meant to be a space where everyone is invited and included. And it's always safe to ask questions. So, in 2019, as I mentioned, Communicate for Health Justice started off as a blog. And so I just have highlighted here a few images of some of the blogs that were written. That's what it was. It was purely a space for people to contribute, you know, on health topics that had a lot of, I guess, connection points to communications or messaging or marketing or advertising. And so I'm just showing a few here. I was going down like memory lane, like when I was putting these into my slide deck. And so you see right here, you know, increasing awareness of healthcare access issues for the LGBTQIA+ community, any connections between culture and health. And what also was great about the initial blog in 2019 of Communicate for Justice is everyone brought their own unique spin to it. The blog is still alive and well. I mean, a lot of times I'm the main person who's contributing to it, but that's not really the main intention. I always want people to contribute to it. So if you're looking at this right now and you're like, oh my gosh, like I'd love to write for it, like just, you know, let me know. A lot of great examples. So in 2020, and also keep in mind COVID. So I'm one of those platforms that was started in the, I guess, the COVID times-ish. I had about 1 year prior to COVID, and then, you know, COVID happened. And so 2020, you know, was kind of a continuation of 2019. I was still trying to have people to understand, you know, what is Communicate for Health Justice? What do you do? How can I get involved? And so that's why you see that we were doing a lot of events, using, again, new media. We were using social media, because I mean, put yourself in a different time frame. I know it's a little bit hard now. Everybody's using social media and all that, but in 2020 and 2019, you know, if you wanted to do an event on Instagram Live, sometimes people will look at you funny, which is like interesting, putting ourselves back in those shoes, but what's the case? And so we did some events using Instagram Lives. We did a lot of tweet chat, which, you know, we're still seeing tweet chats, which is essentially an event in which you'll use your Twitter account to tweet about a topic that means something to you or your organization. And you'll usually have pre-made questions, and then you share those out with your partners prior to the tweet chat. We also did movie screenings on public health issues, and those were also quite successful, specifically for Fridays. You know, because sometimes Friday events can be hit or miss. This is an example of a tweet chat that we did with Salute America, and they're a very well-known health education site online and on social media for Latinos and also other affiliated communities. And so this is bringing me way back, March 24th, 2020, what you should know about coronavirus. And so again, put yourself back in the shoes when we were still figuring out what is this COVID stuff. So we did a tweet chat with them, and you can see all the different partners here in our logos. There's my logo right there. It used to be white and now it is black, but I do change it, depending on whatever infographic I'm using. So in July, and this might be new to some of you, July is, I'm sorry, this is June, I'm getting ahead of myself. July though is Minority Mental Health Month. And I just say that because if you're looking to focus on mental health, right now we're in May, and you can always continue focusing on mental health and mental health equity in July specifically, because that is the month that we celebrate mental health for people of color. And so, but jumping back to June, in June of 2020, Communicate for All Justice had a month of events focused on the terminology I like to use is safe spaces. And so I worked with a few different folks, 4 folks in total, who each had interesting backgrounds, somewhat connected, I would say, to mental health. I think that's why I'm going back and forth with the July. But Sonia here, she is a fitness instructor and an anti-racism consultant. And so she does really amazing work connecting, once again, another concept of fitness with how to be anti-racist. And so a lot of the people that I invite onto Communicate for All Justice platforms, they're unique, they have unique connection points. The work that they do is, it's about building bridges and building connections between, ideas that maybe people don't see as connected. And so Sonia is a great example of that. Another tweet chat we did with APHA and the Health Equity Initiative, focused on mental health. And so that was May 19th. I tell you, I love looking at all these. I'm like, wow, I'm really doing a lot. And so again, Communicate for All Justice is millennial driven. So oftentimes I will try to work with groups that focus on supporting young adults or youth. And so this was an event that we did with the Black Mental Health Alliance. They're based in Baltimore, Maryland. And they had an event focused on youth mental health and wellness. And so I spoke on, communications and health equity. And if you're not familiar with the salute, that's from Black Panther. And so this is in honor of National Minority Health Month, which is April. And so we did have a few events that focused on Minority Health Month. We had a really great lineup of speakers, just amazing folks that do amazing work that does tend to center racial justice and then something else, because it's important to uplift that. Okay, so moving on to 2021, still in COVID. And also 2021 is interesting because I was also working on a COVID-19 or public information response to COVID-19. And so my time with Communicate for All Justice was a little bit more limited in 2021. But we did have a really great event in the beginning of the year that focused on millennial public health perceptions on COVID. And so you can see kind of the age distribution between some of the attendees. And so it ended up being an event in which folks were given, survey questions, and then they reached out to their fellow peers. What do you think about COVID? How's it impacting your life? Is it not impacting your life? And so we were just trying to get an understanding of that. So you can see on this survey, like most of the respondents answered neutrally to some of the survey questions. And then the average age of the respondents was 33 and majority identified as women. So that was the majority of 2021, again, because I was working on a public information response to COVID, which did take up a significant amount of my time. And so this is probably the majority of what, I was working on in 2021. Now moving on to 2022. We've already had a few events in 2022, but I'm highlighting this one right here. So some of you might even have attended Speak On It. I did share it in the IHA forum. So Speak On It was a gathering of communicators, and actually I think it will be something that I would do biannually or annually. And it's just an event to really bring together people who do health communication, but with that racial justice focus or that social justice focus, because at this time, there's no other group that's doing that. And so again, Communicating for Justice is really an innovating point within the health communication space, because we're challenging existing ideas while also working in health communications. And so it's really innovative in that way. And so this is just an image from the panel that we had. And this happened on April 5th of this year. Another thing that I'm hoping to focus more on is consulting in 2022. Again, probably because I am switching more to this business model for this platform. So just, keeping that in mind. And then there's a promotional Instagram post about this event. But it went very, very well. We had around 70 attendees, and attendees were from 3 countries. And so we had folks from the States, as well as the UK and Canada. So getting a little bit closer to the new media piece of this presentation, Communicating for Health Justice is, trying some new things when it comes to creating content that is original, that is focused on racial justice, and that can be distributed. And so something that I tend to use, which I don't think a lot of other platforms are using, is these new types of digital products. And so when there's a concept that, me really, because there's only one person on this platform, it's just me. So when I think of a, concept, for example, I did a social media post, but also there will be a workshop later this summer about digital blackface and where it shows up in public health or healthcare messaging. So I will sit down and I'll think through, okay, what is my concept? Like I'm drawing my concept map. And then now what I'm doing is I'm actually offering these digital, think of them as maybe like a workbook, but it's only about 3 pages, where you can purchase the themes and how they're broken down online, straight from Communicate for Health Justice's website. And you can utilize those, while again contributing, because this is a business now, it's a business model. And so that is kind of how we use digital products. And so what you see here are 3 different examples of things that you can actually purchase. The Racial Diversity in Health Communication report is actually free. And so I'll put the link in the chat later, but that one is free. When it's a concept that I have instinctively created, that's when there is a price associated, because that takes time, it takes energy to create that and disseminate that. So, but these are things that you can actually purchase. Now, if you want to work directly with me and you want to re-envision something that you are working on in your organization, that's more of something that we want to do consulting. So this is just a little bit explained in more detail and gives you more background on how I create these products. And so I like to think of them as NFTs. I'm sure we've all heard of NFTs as of late. So they're really one of a kind. There's no one else who, like a concept or a digital a piece of digital information that I create, you're not going to find it anywhere else. And so they really are like NFTs. So they thoroughly examine health communication through a racial equity focus. And these are really, you can think of them as like sneak peeks to, if you wanted to work with me and work with Communicate for Justice, you can go here and purchase one of these. And that really gives you a better understanding of how my thought process is and how I connect concepts. And so yes, that's kind of what that is. But in terms of the resources that I use to create these, my brain, for one, to actually think of these concepts. And then I do use Canva. Canva is an amazing resource if you don't use it currently. I also use Visme, and Vimeo for video editing. Also use iMovie. And then PicMonkey is great for if you're changing filters on your images. In addition, there's me. So Communicate for Justice, and this is really goes for anybody. So anyone who's creating a platform, I would say in 2022, you have to really think about where you are going to highlight this kind of influencer model. People want to know who creates the information that they're seeing. It doesn't matter if you are focusing on, journalism or health communication or advertising. People want to know who is behind it. And so that was interesting for me because I'm kind of more of like a reserved type person, but people do want to know. So Communicate for Justice takes on this influencer model. So you will see me from time to time, whoever's doing the interviews, that's usually me. And yeah, that's just kind of how the cookie crumbles, as they say, in 2022. When you do take on an influencer model, you do want to keep in mind content management systems, because you probably will not have all the time in the world to post your social media content. I use I think 3 different social media content management systems right now at one time, in order to make sure my information is posted accurately on each channel. So for my Instagram, I use one platform, Meta, the Meta Business Suite. For my Twitter, I use Buffer, and for my LinkedIn, as well as Twitter sometimes, I'll use Loomly. So I do use multiple systems to batch my content, and I do end up batching my content. I like to aim to get the whole month worth of content posted on my channels done by the first week of a month. So anything, and so sometimes you'll see stuff that is more current. Like I think yesterday or 2 days ago, I posted about something that was local in DC, where I'm currently living. So sometimes that will happen because you do want to, again, you want to stay on trend, you want to stay in the loop, you want to stay within the culture. So you can't batch your content in a way that feels out of date or out of sync with what's going on. People can tell, and they don't really like that. And so it's important to make sure that even when you're batching content, that it is timely. And then also any equipment that you need. So like for me, I like to make sure the lighting is good. You might want to have a ring light. Those can be purchased pretty much anywhere. Or like a selfie stick that will help you, record, yourself if you are, doing an Instagram live or something like that. But this is all connecting back to that influencer model, inviting people really into the work that you're doing. Because even if it's about health communication or something, related, people still want to kind of get to know you as a person. And social media activism. And so I included this here because even in 2022, we're still in a space where people are kind of afraid to take a stance, honestly. And so we're in a really interesting moment right now in terms of the discussion around like women's rights and, and so, and really all people's rights, there's connections, without getting too far into the weeds, when we see changes within, significant, if we see significant changes to like our legal system or the Constitution, those changes can really affect anything. And so that's a lot of the discussions that I'm hearing in the circles that I'm in. And so, you know, as a business, presenting yourself as educated and aware of activism or the things that are happening around you is very important, especially if you are going to engage the largest generation right now, which I believe is millennials. So if you're going to try to engage us, we're not going to really pay attention if you're not really addressing certain things. And I don't want to speak for Gen Z because I'm not Gen Z, but I do think there's some correlations there too in terms of social media activism. And so as these generations are growing, if you're not updating, you're not staying with it, you're not staying in the culture and staying aware, then you're going to fall by the wayside. And that's kind of an important piece of falling in and understanding the new media. Because the same old is not really, doesn't work anymore. So I love this image. The Instagram creator who created it, you can see their handle right down there. So if you want to take a screenshot, you can look them up. I'm a big fan of supporting artists and the work that they do. You'll see examples of art all throughout Communicate for All Justice. That's actually something else I could say, adding to this presentation. But supporting local artists, supporting Black and BIPOC artists is very important as well. So if you are doing, if you are creating content and you're like, well, I don't want to have to use a stock photo, maybe look for a local artist, support a local artist in their work, and then attach that to, maybe your event that you're having, or something else, some other programming that you're having, because supporting the work of folks is key and it's connected to health communication, health literacy, and specifically if there are artists that are talking about health justice, because there are many who do. Okay, and then this is Marie Pepper, and she's based in New York and DC. So this is a great example. Actually, this image was included on Planned Parenthood's website. And so this is, the artists that I do highlight, they're also doing work with other affiliated organizations. And so sometimes utilizing art is another great bridging point to connecting your viewers or your the folks who are following your social pages. Sometimes they might recognize a piece of artwork and then they might be like, oh, okay, so what are they talking about? What are they selling? So I just offer that. The resources that I use for informing myself on social media activism, Instagram is number one. I don't actually use TikTok. I included it in here because I know it's popular, but there have been some problematic things that have been happening with TikTok, including Black creators, young Black creators not being credited for their work. And so I just offer that. If you are going to use TikTok, make sure you're crediting people. I've even had some issues with people not crediting me. And so it's very important that you're not continuing injustice while talking about justice. So I'm just keeping that in mind. And so, yes, I definitely lean very heavy on Instagram. It's probably my most utilized new media tool. So I finished pretty early, but I do want to offer plenty of time for questions from folks. And even if you need me to go backwards to a slide, I'm happy to do that as well. And let me just see if I have a, nope, I do not. So I'll put my information in the chat. Oh, there are questions in here already. Perfect. Let me just quickly put my information in the chat, and then I will respond. Okay. Exit here. Alrighty. Thank you. Thank you. I just want to get my website link in the chat. Computer's being a little bit. Oh, an IG handle. Yeah. So it's just, I'll put both of them. So that's the Twitter. And this is the Instagram. And Twitter is just the name. Thank you for that question. Oh, thank you, Giovanni. Okay, so I'm gonna work backwards. Let's see, 122. So can you speak more about the digital blackface? Sure, I've gotten a lot of questions about this one. And again, that's what Communicate for Health Justice does. We challenge existing, commentary about health communication. Digital blackface loosely outside of health is when, images or imagery of Black people is used in a way to sell things, but it's not necessarily with the intent of contributing back to the Black community. That is really what digital blackface is. Unfortunately, we see a lot of it today because, again, this feeling or this want to be on trend, Black culture, just to be honest, really sells, from Black Twitter, that's a great example. Anytime something happens, it's usually on Black Twitter, and then people go and see, oh, okay, what's happening? To fashion trends and all that. And so, unfortunately, I do think that the same thing does happen in some health-related spaces, in which there is a wish to really come off as equitable when, we don't necessarily know. So I think when you're using images or imagery of Black people, really look back at your organization and say, well, do we have a DEI system in place? Do we have Black staff on our team? If we don't have that from the start, then it's a little hard to want people, specifically Black people, to look at your content and engage with it. And so I do encourage people to go to the website, and then you can purchase that handout, or you can go to the Instagram. The social media post has like 400 likes on it and generated a lot of, feedback. And then actually I can put my workshop in here. I'll do that now. So I will have a workshop on digital blackface in August. So that is coming up. Let me see what else is in here. Can I save this? Oh, wonderful. So I can save the chat. So I will follow up with everybody because you have really great questions. Yes, Black Illustrations is good. There's a few other ones too, because at this point, there's more people who are saying, you know what, we need images of diverse folks, in our messaging. So there's a few, but thank you for adding that as a resource, Tracy. I'm sorry, 1 second. I'm trying to get a lot of things going on. So this is the link to my upcoming workshop. What is a DEI system? Oh, just like, do you have diversity, equity, inclusion in your organization? So it might not be called DEI. Tiffany, what suggestions do you have for working with staff or students that may not know they are speaking, writing, or working from a discriminatory space? Yeah, that's a great question. So this is actually a part of my approach with Communicate for Health Justice. We start from a place of honesty. I don't know everything. You probably don't know everything, but we need to come together from that place of honesty and saying, you know what, I don't know everything about this. We live in a culture where everyone wants to come off like they know everything, but that can actually be very harmful if we start really thinking through, people acting without knowing the backstory of things. And so that's something I try to keep in mind, because again, there's a lot of different versions of equity. I'm growing in all the different versions. The one that I do focus a lot on with Communicating for All Justice is racial equity. But that's still one piece of, the pie. And so I would say starting from a place of honesty and maybe pulling that person aside, maybe not making it a large, thing. Could you include the link to the resource guide that you mentioned in the chat box? Yes. So, Iman, I'm sorry if I'm mispronouncing your name. The website link that I posted, if you go to the Communicate for All Justice store, you can be taken to that link directly. Let's see here. What else? So from Phyllis, how would or could this concept be used in practice for patient health literacy? We are already adding cultural and racial plain language, photos, etc., to help patients understand. Are you marketing this to community-facing health communication experts in particular? Use this in practice with patient health literacy. That's a great point. I don't currently work with anyone in like the medical space who might be working with patients. I'd love to. So if you're working on that, I'd love to connect with you. Most of my work is focused on, like you put at the end of your question, health communicators. And so for the most part, the ones that I've communicated with, no one is working that directly with the medical community. So I can't really answer that. But that might be a great project that we could work on, Phyllis. So definitely reach out. Let's see. Can you please repeat some of the content management systems you use? Yes, Angela. So Loomly, that's Loomly, and Buffer. I see. Mauricio put it on there. So yes, Loomly, and then Meta Business Suite is for Instagram and Facebook. I don't use Facebook, and that's just a personal decision. But you can like the Instagram and Facebook, they're in partnership. So you can post what you post on your Instagram to your Facebook simultaneously. How do we get connected to contribute to the blog? So definitely, Irene, am I saying your name correctly? You can email me and then we can just set up a time to talk. And then, I'd love to hear more about what you'd like to write about. Oh yeah, for sure. NFT that's a whole other example of new media. It's like transferable. Yeah, it's something like that, non-transferable, but it's very popular right now. Let me see if I can find you a link, and then we'll start from there. Oh, wonderful. So I just posted a link to what are NFTs. Great question. What specific problems need to be solved? How and what? So I did explain that already in the beginning. The challenge is that traditional health communications is missing a health equity and social justice focus that takes history and current social movements into account. That's what Communicate for All Justice does. No other organization is doing that. So that's the problem that we solve, and that's why who we connect with and consult with. Yeah. Oh, wonderful. So Tiff, definitely send me an email and we can connect about that blog idea. Someone said AOC. That's funny. I like GIF. All right, so let me scroll down and see if there's any more questions. Thank you, Marcia. Non-fungible token. Fungible? Yeah. Look at us generating conversation already. So I did save the chat. So Tiff, I do see your email in here. So we'll definitely connect, and then anyone else who had emailed. Any other questions? Finished really early. You're very welcome. I enjoyed, talking about this platform. It is, again, like I said, it's a passion project of mine. And I just like to continue seeing it grow. And yeah. And also make sure you check out my personal website, because that's where I post and share any speaking engagements that I'm doing. And so I have one next week with the CBC at their Spring Clear Writing Summit. So yeah, just check me out on there too. Oh, wonderful. Thank you, everyone. Thank you for your nice comments and everything. Well, yeah, I mean, if there's nothing else, I guess I will end early, but thank you all for being here. And, if you have any other questions, send them my way. Let me just recopy my email. Thank you. Thank you all. Have a good one. Have a great rest of the summit or the event.